what a lot of patients don't realize, and also a lot of physicians who refer to us don't realize, is that there are different types of shoulder replacements. Each has its own unique indications, and our challenge, and our gift is that we get to help patients along this road of picking the right indication and the right implant for the right patient.
Well, I had consulted, first of all, with a couple other doctors that had procedures somewhat similar, but I just felt so good about what Dr. Agrawal had to offer, and it seemed like his knowledge and the fact that he's strictly a shoulder specialist and does not do, that I'm aware of, other hips or other joints. He specialized in the shoulder, and that especially attracted me. I wanted to feel back to normal and do some of the activities that I did without pain. I believe I started feeling normal after the operation within about 3 months. I had a lot more free range motion than I had for the last 2 or 3 years, and it's just gotten better ever since those 3 months that went by.
Great. And the motion was restricted prior to the surgery, and how can you move your arms now that you could?
I can show you how I move my arms. It's the left arm that I had the problem with, and I do have a problem with my right one, and it's becoming worse all the time. But my left shoulder, I can swing a golf club. I can do whatever I want to do with it.
And so I said to him that I think with everything I have available, I think a regular total shoulder replacement should serve you very well for pain relief and function.
I think Dr. Agrawal has just been exceptional how they've handled me when I make appointments. Everybody's just been terrific, from the receptionist to the nurse to Dr. Agrawal is just a terrific guy. So very good, like no one else I've been to.
I've been fortunate to have trained with some of the world's best shoulder specialists. So along with that, we've also been very fortunate to have one of the busiest practices in the nation for shoulders. Based on her particular circumstances, we felt that the reverse total shoulder replacement would be the best option for her. What's variable is how quickly people get their function back, meaning the strength and the power. What isn't so variable is how quickly the pain relief comes. Almost uniformly, I find that pretty early people find that aching, gnawing pain that they had is gone post-op.
Well, I think that it all started when I came out of a Christmas party. Absolutely no drinks any whatsoever, but I missed the last step and went flying across my friend's driveway, and I landed on my shoulder. I take great pride in the fact that I didn't spill any of the chicken salad that I had, but I think within 6 months I was beginning to feel the effects of having landed so hard or full force on my shoulder. And by the time I made the decision to have surgery, my arm, I couldn't get it up any higher than this. But now, a year later, I'm doing this and having a great time in water aerobics.
We have a very relatively comfortable rehab program. We're not very aggressive, so I try to do aquatherapy if that's available. Otherwise, we just have people lie down and take gravity out of it, and then eventually I tell them, hey, when you can move your arm that way without trouble, then just add a little bit of weight, and then once you get to a certain point, then we have them stand up, and sure enough, they can pop their arm right up, and it's not unusual for them to call and say, hey, you were right, I can move my arm, I didn't need aggressive therapy, and Anita was a perfect one, and so now she's back swimming, doing water aerobics. I think patients don't necessarily understand that the learning curve for something like an arthroscopic rotator cuff repair or a global repair for instability or a total shoulder replacement or reverse total shoulder replacement is huge. Most surgeons in the United States do 1 or 2 shoulder replacements a year, and the number of surgeons doing more than 10 shoulder replacements a year are only 1 or 2% of the entire population. So if we were just doing something once or twice a year, it'd be very difficult to get to a mastery level.
They did the replacement on September the 23rd of 2005. I went back into physical therapy and was not happy with the results. My shoulder was coming out of the socket, and the physical therapist suggested I come down and see Dr. Agrawal. That he sent me for a number of tests to see if I was an eligible candidate. And on June the 4th of 2008, I had the reverse shoulder replacement. And since then, it's just been getting better all the time. I feel I'm as close to 100% as you can get. I have complete mobility. I can do now shampoo and put up my hair and do and I am a quilter. I design and make handmade quilts. And to have the dexterity in my fingers was so important to me.
Her cup side was really tilted forward, a significant amount. And so we worked through the entire thing, and once we'd done the workup, I said to her, look, I think, we'd have to take out all your other components. I think that I can get enough bone from the ball side to really reconstruct that part and do a reverse, because it's going to take the stress off that part of your cuff that's not working. But I said, look, it might be a year or more for you to get everything back, but I think it'll give you pain relief. And so ultimately the reason specialization's been driven, especially in shoulders, is that it's better for patients. A lot of people are aware of hip and knee replacement, and if you look, people who do hundreds and hundreds of hip and knee replacements a year have much better results than people who just do a few a year. And that's even more so true in shoulder replacements.